folks. We're just waiting on a few more people, and then we'll get started in about 1 minute. All right, so I'm going to go ahead and get things kicked off. This is Carrie Myers from your HR team. We're going to go ahead and get going on our 2018 benefits discussion. Just a heads up for everybody that this session is being recorded for those that aren't able to attend today. So if you do have any questions or comments, just keep in mind that that will go on the recording that other people will see. We have 3 guests today that will be speaking with us. Give me just a second here. Apparently my computer's a little angry with me. There we go. Is everybody able to see my screen okay? If you're not, please let me know. The session is being recorded. We do have myself and 2 other guests that will present today. So I have Brad Niebor on the line. He's from M3, who is our insurance broker. He'll be talking to you today about health insurance trends. I will be taking over some other benefit updates, and then Amy Jo Cross will join us for some wellness updates. Just very quickly, we will have some time towards the end for questions. I do ask that if you have questions in this session, please make sure we keep them to general questions that apply to the whole group. If you have personal questions, we're happy to address those. I just don't want them addressed over this recorded session. So please reach out to Amy Jo or I, and we'd be happy to answer those for you. If you are calling in, please make sure you're on mute. And we're going to go ahead and get started. If Brad, you want to go ahead and take it over.
Sure. Thank you, Carrie, and good afternoon, everyone. As Carrie mentioned, my name is Brad Niebor, and I work for M3 Insurance. We are an insurance broker, which means we are not an insurance carrier administrator. Although we represent over 100 carriers and administrators nationwide, we work with thousands of employers nationwide, like all family enterprises and all their subsidiaries, in helping them with their employee benefits. As you all are probably aware, whether you turn on the TV, read a newspaper or magazine, healthcare costs in our nation continue to rise. And our elected officials, those men and women, try to fix this problem year in, year out. And it is just such a global problem, the way costs continue to rise, that I think it will be a continued discussion for many more years and decades to come. People always ask me, why do healthcare costs continue to go up the way that they do? And, you know, we could probably talk for hours about this for 100 different reasons why. But on this slide, you will see some of the top drivers of healthcare costs in our country and why they continue to increase year after year after year. The first one is medical technology. Although we as Americans don't live the longest on average versus other countries, we do have the best medical technology in the world. And we continue to come out with more and more new technology that allow us to live longer lives and better lives. But obviously costs go up with that new medical technology. Kind of the same with prescription drugs. We have more and more medications that allow us to live longer lives, allow us to live better lives, allow us to beat diseases that we, would have passed away from in the past. But with these new specialty medications, which some of them cost $10,000 a month, believe it or not, some cost over $100,000 per month. Once again, there's a lot of positives with them, but obviously with those costs, that's going to have a huge impact on healthcare costs rising over time. In our country, we have an aging population, and it affects life as we get older. We need to go to the doctor more. We need more medications. And with that, healthcare costs continue to increase. And then lastly, chronic diseases. So these are the asthmas, the diabetes, the heart attacks, strokes, cancers. Those account for 75% of all medical costs. Now with chronic disease, some of that is hereditary. There's nothing we can do. It's bad luck. But some of that, and some experts say over 50% of the time, those are lifestyle related choices. How we live our lives has a big impact on the chronic disease. So once again, just a few of the bigger reasons why healthcare costs continue to rise each and every year, and why in our country they're probably going to continue to increase year after year after year going forward. You work for an employer in Demco and Wall Family that they look at this not just one time, 60 days before the renewal, and make a decision. There's multiple meetings, conference calls, going out and looking to make sure that we leave no stone unturned, because you have an employer that wants to continue to offer quality coverage. You have an employer that does not want to have you change who your primary care physician is year after year after year. And they want to be able to keep you, the coworkers, monthly contributions, what comes out of your paycheck, as affordable as possible. So what we did this year is we did look at combining all of the out-of-area coworkers under Wall Family Enterprise for one group quote. And the reason why we're able to use the various entities is that, once again, it all falls under one common owner, the Wall Family Enterprises. So we do appreciate you filling out an application. Although we did go to the market and try to see if we could find one carrier that would, be the carrier for multiple entities of Wall Family, it was not competitive. So once again, we thank you for completing that paperwork, but once again, it was not competitive. We did go to other carriers for the Demco Software team outside of United Healthcare, and they either declined to quote because they weren't competitive, or if they did quote, it just did not make sense financially or benefit design to make a switch. Basically, nobody was as competitive with United Healthcare. And then we obviously always do negotiate with United Healthcare to try to get the renewal as low as possible so that your contributions will be as low as possible. So as I mentioned, there's no competitive offers from the out-of-area coworkers that we went to. On just Demco Software, there were no other bids or if the carriers declined to quote. We started with UHC at a 17.6% increase, and we were able to negotiate with United Healthcare, even though we really didn't have any leverage. And what I mean by that, competitive data, or competitive quotes, we were able to negotiate them down to 11.09% increase to premiums effective December 1st. The next slide here shows some benchmarking. And what we do at M3 is we take all of the clients, the thousands of employers that we work with nationwide, and we say, okay, what's the average deductible and so on. And this is one item in health plans that has really changed in the last 5 to 8 years. And that is what the average single deductible and family deductible is that's offered through an employer plan or plans. On the far right, as you can see, we only have 2017 benchmarking data. Since we're not into 2018, we won't have that for some time. But as you can see in 2017, for a large deductible plan, the average single deductible was $2,804, and the family would be basically double that. As you can see in 2017, you were at a $3,000 single deductible, and you will remain at that deductible for 2018 as well. Lastly, before I hand it back to Carrie, one of the things that we always try to do and try to do a better job of each and every year is, educating everyone on how to be a better healthcare consumer. And it's not the easiest thing to do. And what I mean by that is that healthcare is the one industry that I know in our country where we're really not programmed to be consumers. We're not programmed to ask questions. And some of that is an overlying problem where, what I mean by that is with the providers, the nurses, the doctors, the surgeons, if we did ask them, okay, the cost of a certain procedure or surgery or anything like that, most likely we wouldn't even know, or they wouldn't even know the cost of that. But just real quickly, to be a better healthcare consumer, we really want you to have a relationship with a primary care physician. The better relationship you have with them, the easier it's going to be to talk with them, ask questions, get additional information, and have better medical outcomes. So just real quickly, if based upon your age and gender, you should have an annual physical, please have that annual physical. Once again, under the Affordable Care Act with your plans, those preventative annual physicals, as long as they're quoted as preventative, should be covered in full under your plans. We want you to be able to talk with your doctor. If you're on a brand name medication, ask if there's a generic available. With generics, they have the same active ingredients as a brand name, which make them just as effective as those brand names, but they're much, much lower in cost, and you have a lower copay as well, too. More and more surgeries are being performed on an outpatient basis. So once again, don't go in and demand to your doctor or your surgeon that if you have a surgery plan that it has to be performed on an outpatient basis. But once again, just inquire, ask questions, you know, what are the other options besides that inpatient surgery? And then you and your doctor can basically together come up with an informed decision on what you want to do going forward. Even though it's close to 2018 and the technology we have, we at M3 have a lot of time each and every year that we spend on with our clients in fixing their bills. And what I mean by that is, even though with the technology we have, there are still a lot of errors, and especially on those hospital bills that are usually the highest cost bills that we have. So one thing that I will stress is that if you have a hospital bill that you do not think looks correct, please reach out to the HR team. They'll get M3 involved. We will be happy to look into any and all claims, because once again, the lower, if we can get a claim corrected, and i.e. it's lower, that's only going to make it easier to have a lower renewal long term, which is going to allow us to have better benefits for you and your family members, as well as lower coworker contributions each month. Also, where we doctor. And what I mean by that is whether it's an office visit through your primary care physician, going to the urgent care or emergency room. Where we doctor, the price changes. And what I mean by that is if you go into your primary care physician, this depends on location, geography, but if you go in, no x-ray, no lab, it's probably about $125 with your primary care physician. If you walk into an urgent care setting, it's probably over $200. If you walk into the emergency room, no x-ray, no lab, we're probably looking at $500 or $600. Now, obviously, if it's an emergency type situation, go to the emergency room. That's what it's there for. But if you can work through your primary care physician, that's where not only are you going to have your best medical outcomes, but it's probably going to be the most cost-effective way to go with your health care. Lastly, the health savings account. This is a great tool for you to build up those dollars. So if a year or 3 years or 7 years down the road, you do incur that deductible, you do have those funds put into your HSA account where you can choose to use those at a future date to help pay for those out-of-pockets. Once again, it's just a great resource. It helps you be a healthcare consumer, and then hopefully over time you can build up enough money that it will hopefully take care of most, if not all, of those out-of-pockets that you have at future dates. Any questions for me before I hand it off to Carrie? Once again, at a high level, I'll be more than happy to stay on afterwards or talk to somebody individually. If not, I'll hand it off to Carrie.
I have I don't know, it's not really a question, or it's well, maybe it's a question couched in a comment. I would love to be able to price shop my health care. But whenever I have tried to do that, I have found it extremely difficult because most often I can't find the right person to ask. A lot of the people in the offices that I have connections to don't know, and they don't get the question often enough, apparently, my feeling, that they know how to answer that question. So I end up getting bounced around, or I get wrong information.
So thank you for bringing that up and asking that question. And whether it's, you know, Indianapolis or that area, or South Central Wisconsin, or Los Angeles, California, that is what happens. And that's where I go back to, healthcare is the one industry that I know of that we're not programmed to be consumers. And if we want to try to be consumers, it is very difficult because those providers are unaware of what the cost is. And not to go muddy the water too deep, but who you're insured with changes their answer too. So they give different discounts, providers, those doctors' offices, those hospitals, to different insurance carriers. So who you're insured with is going to change their answer as well too. But one thing that I can do is let me make a few phone calls. There may be a tool or two online that you guys may be able to use in the future that's going to get better. It may not be perfect now, but it may get better, where you can go online, put in whatever you're going to have done. Let's say it's an MRI scan, and see in your area what the costs are. And I think United Healthcare is building that out. And by geography, it's different. Some of the geographies, they have that done. Some they do not, and they're still working on it. But I'll get it to Carrie if they do, and she can get it out to everybody. But UHC, I think, may, if they don't now, will in the near future have a tool for you to do that. So it'd be more online as opposed to calling and talking to somebody live.
Great.
Thank you. That would certainly be a place to start.
Yep.
Great question, Kim. Anybody else with a question for Brad before I take over? Okay, so just two things I wanted to add on to what Brad had to say. The first thing I wanted to add on is I just wanted to confirm that Demco will continue to pay 75% of your health insurance premiums. So when we say that you're going to have an 11% increase, Demco will continue to pay their portion of that. So you won't see that full 11%. That will be spread according to our split. The other thing that I wanted to mention, and this will be documented in your paperwork that you'll get from me, but when we talk about generic versus brand name, I really, really encourage you to have that conversation with your doctor. Not everybody is right for a generic drug, which is why I'm telling you to ask your doctor about it. But after one of our last sessions, we did a little bit of digging on an EpiPen, which is a very, very common brand name drug for people that have allergies. And we found, and some of you may have heard this in the news, but the EpiPen, the manufacturer of the EpiPen, which is the brand name, is under scrutiny because the cost of the EpiPen is extremely high. And they recently announced a generic version of it that's available, and the difference between the two pens is $190. $190, same exact medication, same makeup. The difference is who actually manufactures the drug. So that's something where if you had a conversation with your doctor, you could both save some money and you could save the insurance company money, which would lower our utilization rate. So just if you're on medications and you're willing to go to a generic, please talk to your doctor about that before you make any changes. But certainly consider what that might be able to do to you monetarily, as well as the claims that we're putting into the insurance companies. So the next portion of my presentation.
Quick question, Carrie.
Yes,
thanks for clarifying about the split, the 75%. Thank you for clarifying that.
Yes.
The other question I have, and this is for the gentleman that was presenting, do we have mail order pharmacy as part of our benefit?
Through UHC?
Mm-hmm.
Yeah, I believe so. Let me, I'll dig into that and get that information out as well. But yes, I do believe so.
Okay, the only reason I ask is because mail order pharmacy, just for everybody's edification, if you're on long-term, especially diabetes and people who have diabetes and long-term sort of prescription, mail order pharmacy can be significantly cheaper than getting it from your CVS or Costco. And that's why I asked if it's available or not.
Great.
All right, thank you.
I've gotten those letters.
Okay.
Yeah.
So I think they do.
Yep.
All right, well, let's get confirmation.
Yep.
And any other questions before I move forward? It's a great point, Robbie. Okay, so we're going to talk about the rest of the benefits that we have in general. So Delta Dental. So for Delta Dental, we have no increase to premiums for 2018. So what you're paying today, you'll continue to pay throughout 2018. We do have open enrollment for our Delta Dental, which means if you're not on it today and you'd like to pick it up for 2018, you are certainly able to do that. You just need to let me know, and we'll take care of that for you. The next benefit we'll talk about is superior vision. We have no increase to premiums on our superior vision as well. So what you're paying today, you will pay next year as well. We have two plans on superior vision. We have a plan that's materials only. So your eye exam is covered through your health insurance provider. This would cover any materials that you might have, glasses or contacts that you would need. The other option is exam and materials, which would cover one eye exam and then the materials option for you and any of your covered dependents. We have open enrollment for both of those benefits. So if you don't have them now and you know you're going to need either of those in 2018, you may pick those up. Your premiums are listed here.
How long can dependents stay on your health plans?
Great question. Dependents can stay on until they turn 26 years old, 26 years old. And that's for all of your insurance options. Next thing I'd like to talk about is the Lincoln and the Unum benefits. So Lincoln provides our life insurance and our accidental death and dismemberment insurance. Unum provides our accident insurance and our critical illness insurance. Those of you that have those benefits, you'll see no increase to premiums for 2018. And I'm going to dig in a little bit more on those Unum benefits and talk about those in just a second here. So the Unum group accident insurance, we don't have a very high enrollment in the Demco Software group, and I want to make sure everybody understands what this benefit is about. Unum group accident actually puts out a cash payment in the event that you're involved in an accident and you require medical care. So it's got a little story here about a man named Rob who was trying to lose a little bit of weight, got himself a bike, rode the bike for a little bit, fell off, and was diagnosed with a torn knee ligament and a broken toe. So Rob had to go into the emergency room and get covered for that. He had a high deductible plan, so he had a big out-of-pocket expense for covering those two benefits. Luckily, he was enrolled in Unum Group Accident, which pays a cash benefit when he goes in for medical treatment, and the insurance company paid him back $900 for those two injuries. Those of you are accident prone, you have a family member that's accident prone, this is definitely something that you want to consider to have just to help supplement both the costs that you might have out of pocket for an accident and also any time that you miss away from work that may be. Just to give you a little snapshot of what we're talking about, these are some of the payments that you would receive under this plan. So you can see emergency room treatment, $150, and then of course emergency treatment by a physician would be another $75. If you're admitted to the hospital, you get another $1,000. So you can see that this adds up depending on what you have going on. And obviously there's going to be a lot of other things that you need to think about in terms of your family, their transportation, you know, making sure that you're keeping food on the table. So this is a nice benefit to have out there. I put these in here. I don't expect you guys to be able to read all of them. I just wanted to give you an idea of kind of the schedule that they have out there. It's slightly morbid, but every accident has a dollar amount that's assigned with it. So they have a pretty wide range of things that they will pay you for in the event of an injury. The flip side to that benefit is Unum critical illness insurance. So critical illness pays a lump sum when you're diagnosed with a certain critical illness. Coworkers can pick the amount that they're covered for and the type of coverage that you have. And then in the event that something of that sort, you do receive a diagnosis, then you actually get a cash payout for that. There's also a wellness benefit that's assigned with this. So every time you go in for a preventative exam, they'll pay you $75 a year to have that exam. So the question is, you guys are saying, well, how come I'm not hearing about this all year long, or why is this the first time we hear about it? There's only a very specific time in the year that you can enroll in the benefits, and we're in it right now. So even as a new hire, you can't pick it up when you're hired. You have to be within our enrollment period with Unum to pick those up. So Unum offers a telephonic enrollment. You have to actually get on the phone with Unum to get pricing on those benefits and to enroll in those benefits. I cannot help you with either of those. So they have a line that you can call into. It's open 7 to 7 Central Standard Time, Monday through Friday. It will be open to you until November 30th. If either of those benefits are something you're interested in, I strongly encourage you to give them a call and at least talk through it. There's no pressure to enroll. They're there to give you information. If you decide you want it, then they can help you enroll in the plan. And then all they send me is the number that I need to deduct from your paycheck to keep you enrolled in that insurance plan. And I will give you all of the information on how to make that phone call as a follow-up from this meeting. Any questions on that? All right, let's talk a little bit about health savings account. So as long as you enrolled in the United Healthcare plan through Demco Software, you are eligible to have a health savings account every year. And just a reminder to everybody, the company does contribute $100 per month for single enrollees and $200 a month for coworker plus one or family enrollment. So that's a coverage that's there so long as you set up a health savings account and you give us the information where we can deposit that money into. In 2018, the annual maximums for single is going to be $34.50. That includes your company contribution, so keep that in mind. And then for coworker one or family, it's $6,900. Now here's the kicker. ADP, we have to align our ADP system with your enrollment, and ADP automatically kicks out 2017 enrollments and starts with 2018 enrollments. So if you are on the health savings plan, you do need to re-enroll for 2018. Regardless of whether or not you do your own contribution, you'll need to re-enroll to receive that company contribution, and I'll send you instructions on how to do that. But anybody that is on the United Healthcare plan should take that step to enroll in 2018 and make sure that you're getting your health savings deposits at least from the company, if not putting some money aside from yourself as well. So when we talk about ADP benefit enrollment, I'll send you instructions shortly after this meeting today. The enrollments are due by November 30th of 2017. And as I said, you have to re-enroll in the health savings account in order to continue to get your company contributions for 2018. And we will not be reminding everybody individually. We will be sending out company-wide reminders to people that you have to get this done, but it is your responsibility to go into the system and do your enrollment so that we can get everybody set for 2018. Are there any questions on that?
Are you going to include instructions on where this is all set up in that follow-up email? Because given the holiday, we just want to get it done.
Yep, absolutely. So in the follow-up email, I actually have screenshots step-by-step on how to get access to it. When you log into ADP, you should get a pop-up screen right away that says, hey, you got to do some benefits enrollment. What do you do? And it gives you the option either to walk through every single benefit you have, to pick and choose what you want, or there's one that says, I don't wish to change anything. But remember, if you choose that I don't wish to change anything, it's not going to automatically enroll you in HSA for next year. So if you know if that's the only thing you're doing is re-enrolling for HSA for next year, do that, pick that selection that says, I know what I want, put your HSA amount in there and move forward. And if you're not doing your own contribution to HSA, then your election is 0 and you go ahead and roll into it. But I will have screenshots sent out to everybody, and I will do that before the end of the day today.
Quick question, Carrie: is enrollment required if only company contribution is there, or enrollment is required whether it's our contribution or company contribution?
So again, regardless of whether or not you contribute, the system will shut down all 2017 deductions and contributions. 2018 will renew. So if you do not take an action to enroll in 2018, you will not get a company contribution. You have to make an action to do that.
Okay, thank you.
Okay. All right, I'm going to hand it over to Amy Jo Cross, also on your HR team, and she's going to talk to you a little bit about health and wellness today.
Okay, so hopefully everybody has been tracking what they're doing for their health and wellness activities and points so you can use those dollars next year. And what I'll do is, if you haven't been tracking, after we get off this meeting, I will send out an email that has all of the forms for you to track, because we are going to be collecting those activity points by December 15th of 2017. So in order to get reimbursed for any health and wellness related item in 2018, you need to turn in your health and wellness tracking points by December 15th of 2017. Okay, and for those of you that did turn in tracking points last year, you may still have health and wellness dollars to be spent. You can email us and we can let you know if you still have money available. But if you do want to use your 21 or 2017 health and wellness dollars, we need to have those purchases made prior to December 31st, or you will lose that money. And then receipts need to be turned in and claimed with the form by January 31 of 2018. If you all remember, probably a couple months ago, we sent out a survey from the health and wellness team where we wanted you to provide us information on what you wanted to see regarding health and wellness events, activities, lunch and learns, and things to consider to adding for reimbursement options. So we looked at those lists and we did add 4 different items this year for 2018 that you can get reimbursed for under the health and wellness reimbursement policy. So the first one is golf and disc golf. So if you're go out golfing, shoes, equipment, we will reimburse you for that. If you are using a golf cart though and not getting that exercise while you're doing that activity, that doesn't qualify, and we're taking that on the honor system. The next one that we're adding is bike and kayak. So a couple years ago, we added the bikes and the kayaks. Now we heard from our coworkers that they need carriers to get them to where they want to bike or kayak. So we have added carriers for those 2 pieces of equipment for 2018. Staying up with technology, we found out that we needed to add fitness-related subscriptions and apps. So those are going to be added in 2018, and then cooking classes as well. So if you take a cooking class at a facility, we will reimburse you for that through the health and wellness program as well. Does anyone have any questions regarding the health and wellness reimbursement program?
Amy?
Yeah.
Can you go through when they need to do a reimbursement for the health and wellness, how they would do that? I don't believe the expense report is the route to do that.
Correct. Yep. So when I email you out those tracking forms this afternoon, I will also email out that health and wellness reimbursement form. So all you need to do is attach the receipt for your purchase, copy me and your supervisor on that health and wellness reimbursement form because it does come out of their budget, and then we'll get that approved, and then it gets processed through your payroll check.
Amy, can you explain the activity points log? I don't know if I missed it or not, but I thought I remembered this and it wasn't relevant to our group.
Sure. Yeah. So with the health and wellness reimbursement tracking log, there's various categories that you can earn points for. So, yep, we've got it right up here. So you can earn points for having your physical, having your eye exam, your flu shot, exercising, and this is all tracked on your own. So it can be exercising at home, exercising at a gym, weight management. If you're staying within the recommended guidelines for your weight, you can earn points, or if you're working on that and attending weight management classes, Weight Watchers, things like that. Tobacco cessation. So our coworkers that remain tobacco free, they can earn a point each month for that. Participating in the health and wellness events. Today we had our lunch and learn for work-life balance. Coworkers that participated in that earned a point. If you're doing the salad bar on the last Wednesday of the month, you're earning points there. Organized races, 5K walks that you may be doing, stress reduction. If you're going in the recommended guidelines for that, safety, wearing your seatbelt, if you're riding a bike, motorcycle, wearing that safety helmet, financial, if you took the opportunity to meet with Kelly from the Francis Investment Council regarding your financial health, you can earn points for that, and then volunteering. So our coworkers that are getting out and volunteering in the community, they are earning points for that. So it kind of encompasses all of the physical, mental, and so on.
So Amy,
Yep.
if you're a non-smoker and have never smoked, can you get your point? Can you get those points?
Yeah, if you do not smoke, there's 12 points right there you just earned for the year.
So for some of these things, sorry, I've never seen this form before or heard about this program. I think our group, we kind of transitioned over from Boopsy, and so some of these things are probably new to the software group, or maybe again I was just
It was, yeah, we had talked about it last year in the benefit communication, but I know a lot was added last year. So, and then it gets emailed out and reminders in the monthly communication. Yeah, so any questions you may have, now's the time.
So for things like your flu shot, eye exam, dental exam, all that stuff, do you need receipts or documentation of that? I mean,
no, we
okay.
trust you.
Okay.
Yeah, we trust you.
You're just, but
yeah, we're not going to make you track all that down. No, it's just on the honor system.
Okay, thank you.
Yep,
So-
if you're having it done, you earn points.
So when you turn this form in, this form is the only thing that you need to turn in. You don't need to turn in anything else, any substantiation, just this form, and we'll take your word for it.
Mhm.
Okay, perfect. Thank
Yeah.
you.
And I'll email that out. And there is another form too that we'll email out at the beginning of each year that is an Excel spreadsheet, so then you can track it each week. So there's two options, either this Word document or the Excel document that you track it each week throughout the year.
Great
Any
question.
other questions regarding the health and wellness program? All right. Any other questions for Carrie or Brad?
Okay. Please keep an eye out for a follow-up email from Carrie and Amy Jo regarding enrollment for 2018 and health and wellness. And if you do have any questions outside of this that you'd like to address personally, please reach out to either of us and we can schedule a time to meet with you.
Thank you, everybody.
Thanks for coming, everyone.
Bye.